We're going to show you how to transfer from the bed or the couch up to a sitting position without putting extra strain on the lower back. So what we're going to do next is we're going to have the patient roll to their side, and what I like to do is do something called log rolling. Imagine you're holding onto a log and you roll to your side. Your head, hips, knees, shoulders all are going to roll at the same time. So let's have you roll to your side now. Good. Now while we're in this position here, I want to have the patient put the elbow right in the mat in a direction with the arm straight out in front of you. They're going to make a fist with the upper arm. Put this hand here like this. So what we're going to do is we're going to drive this elbow into the mat as we go to sit up. So we're going to sit up more towards the laterally way. What we're going to do is you're going to tighten your stomach like someone's going to punch you in the stomach. You can keep that tight. First thing we're going to do is we're going to start moving the legs off the table. As soon as the legs come off the table, push arms into the table, and then we're going to come up like that. We want to do this fairly quickly so we can use the momentum of the legs dropping off the table to help the patient push up and come to a sitting position. This method of sitting up is a significantly better way of trying to get up to a sitting position so you don't overload the lower back, including the discs and the muscles down there, the ligaments, which if you try to sit up in another way where you're just trying to sit up from a supine position, you may overload it with sometimes 4 to 5 times the amount of pressure on the lower back. So anybody with any history of lower back symptoms or fresh out of surgery, definitely want to try to do this type of motion versus the old-fashioned way. Roll to your side. Okay, get the arms in the right position, push up, legs up, tighten the stomach, push up. Very good. What we're going to demonstrate now is going to be how to get into the bed properly without putting any extra pressure on the lower back. Basically what we're going to do is we're going to have the patient lay down on their side, lowering themselves down onto their elbow, at the same time picking the legs up, putting them back on the table. Once you've laid down in this position, we could have the patient roll back evenly with the head, shoulders, knees, hips, everything at the same time. That way we don't overload any particular area and overload the spine specifically.